All right, so our group topic is ACT, which is Acceptance and Commitment Therapy. And the group members include Alexis Woods, Avery Mcdonald, Caroline Gibellato, Kaitlyn Davies, and myself, Sydney Anderson. These will be our topics of discussion. So first we'll go over an article, second on TABA, third description of ACT, and then fourth discussion and questions.
So the first thing we're going to discuss is Bear, Wolf, and Risley, 1968, the defining features of ABA. So the first one that I'm going to discuss is applied, and the word applied may be referred to as the importance to man and society. So acceptance commitment therapy is in fact considered applied because the main goal of the therapeutic intervention is to improve the quality of life for individuals. And by improving our quality of life through this intervention, this will allow us to thrive personally as well as socially. And in addition, acceptance commitment therapy implements positive reinforcement within the intervention and encourages individuals to defer from negative reinforcement behavior. Again, the second dimension is behavioral, and in relation to ACT, the main concept of this intervention is to commit to our actions and our behaviors to improve our lives. In addition, ACT can be known for increasing our awareness to negative behaviors that we engage and to display overt behaviors towards things we truly do enjoy in life. To be successful, we must focus on doing rather than thinking throughout ACT interventions. And the next one is analytic, and ACT is known to display desired outcomes when therapy is consistent and followed through. Multiple studies have displayed to show that ACT is in fact analytic. There has been 200 plus trials that have been completed, and as a result, ACT has been empirically supported. So the fourth dimension, as we know, is effective, and evidence suggests that ACT improves socially meaningful behaviors. As quoted by Bear, Wolf, and Risley, they said in the article, if the application of behavior techniques does not produce large enough effects for practical value, then the application has failed. So as a group, we believe that ACT has been recognized for changing people's lives, and that is considered enough to be considered large. And next we have conceptually systematic. So from our research, we found that ACT is currently still up for debate, whether it is part of ABA or the clinical psychology field. And to our knowledge, it's a bit part of both. Clinical psychologists and therapists currently use the ACT card deck because it's a consistent practice that encourages meaningful action to reach therapeutic goals. ACT does not necessarily follow all the principles of ABA, as it is meant to be flexible and individualized for each client. ACT is most often implemented one-to-one basis because of the flexibility it has to meet each client's private needs. And next we have technological. So this one, ACT, I would believe that has the most difficulties reaching the definition of technological. So ACT interventions, as mentioned, are meant to be flexible. Standard interventions for ACT do take place to ensure consistency among all clients. All standard interventions apply acceptance, present moment attention, self as context, diffusion, values, and committed action. And lastly, generalization will be discussed. So generalization is a must when it comes to any type of intervention. ACT is implemented to build new habits based on the commitment to the intervention and commitment to the goals one is trying to reach. ACT encourages individuals to engage in such behaviors that will be useful across all dimensions of one's life.
So for the second part, we talk about ONTABA and if ACT is evidence-based, emerging, or an unestablished therapy. Since ACT is categorized under a third wave of CBT, it doesn't actually have its own category on the ONTABA. But since it is categorized under CBT and CBT is evidence-based and established, ACT is a newer wave known as the third wave. So the first wave focuses on classical conditioning and operant conditioning, and the second wave focuses on information processing. And since it is a newer wave, it would be considered as an emerging form of therapy.
So for the third part, we'll be doing a description of ACT, which includes the development, goals, training, ideal demographic, and our thoughts and experiences. So ACT, or Acceptance Commitment Therapy, was developed in 1986 by Professor Stephen C. Hayes. He was a psychology professor at the University of Nevada who took a particular interest in how language and thought influence our personal experiences, such as sensations or urges. This then set the framework for his discovery and development of ACT. He was very intrigued with the concept that humans tend to avoid undesirable emotion, and when he believed that they should never be avoided, and that it is inevitable for us being human. Suffering is inevitable and an essential part of being human, as well as a source of fulfillment when we do not flee from what scares us. The main goals of acceptance and commitment therapy are as follows. Creating a genuine and meaningful life is always the main priority, and this can be done by first accepting that pain is the first barrier to overcome, and that overcoming that fear is the first step, and allowing yourself to accept that pain as a part of life and should be accepted and not avoided. This brings us to mindfulness. Being mindful is consciously bringing awareness to your here and now experiences with openness, interest, and receptiveness. There are many ways to do this in our daily lives to be mindful, including living in the present moment, engaging entirely in what you are doing rather than getting lost in your thoughts, and allowing your feelings to be as they are, letting them come and go rather than attempting to constantly control them.
So how is ACT implemented? To begin, there are 6 key components of ACT. So the first is mindfulness, which incorporates observing your experiences in the present moment and being grounded in the experience. 2 is acceptance, which means accepting the experience as it is, as well as the emotions, thoughts, memories, and other things that accompany the experience. 3 is living a value-based life. So you have to think, are you living the life the way that you want to? Are you practicing the values that you believe in? Are you living the life you have envisioned for yourself? And if not, what is holding you back? 4 is commitment. So that's doing what matters in congruence with the life you've pictured above. Don't think, just do. And then 5 is cognitive diffusion. So that is observing your thoughts as they are happening. Do not respond to these thoughts or hold on to them. Simply observe that you've had them. This will help foster letting those negative thoughts go. And then 6 is self as process. So that's basically believing that you are separate from your thoughts and regard them as an entirely separate entity from you. There is a part of you that experiences the moment and lives your life, which is separate from that which has these intrusive or overbearing thoughts which are causing distress. So what does this look like in therapy? In a one-on-one session with a therapist, you will listen to your own self-talk. So self-talk would be the way you speak about yourself, your trauma, your experiences, the relationships you have in your life, and more. And then you would decide if an issue you are experiencing requires immediate action or your acceptance. An issue requiring acceptance may be something that you or your therapist feels is out of your control. If an issue requires acceptance, the therapist will help you incorporate daily coping mechanisms and practices to foster acceptance of the issue at hand. Once your issues are faced and acceptance is being practiced, the therapist helps you commit to a more mindful life where you stop fighting your past, emotions, and thoughts, and instead to practice and implement more confident, optimistic, and mindful behaviors. The therapist will suggest ways in which your current behavior fosters your negative thoughts and beliefs and ways in which you can change that. So here are 2 worksheets which may be used in ACT. The worksheet 1 on the left incorporates components such as observing the thoughts and experiences in the present moment and what your core values are. Whereas worksheet 2 on the right is more focused on being specifically present in the moment of an experience and acknowledging but not responding to the emotions which that experience elicits.
All right, so this is the ACT card deck. The ACT card deck is an example of how this type of therapy can be used for real life application. It is a deck that has 55 different practices based on acceptance and commitment therapy. As you can see on the slide, there are 3 different suits. They are open, aware, and engaged. Each suit offers a different type of reflection or activity. Some cards are more of a self-reflection question, whereas others are more so encouragement or providing new perspectives. The whole purpose of these cards and ACT in general is to help the clients live more in the present moment rather than dwelling on more past negative thoughts.
And how can you be trained in ACT? So there's actually no official certification process to be able to practice ACT, but it can be taught by a therapist who has in-depth experience and knowledge implementing ACT in their own practice. They may be called a peer-reviewed ACT trainer. People who wish to implement key components of ACT in their daily lives can do so through the use of books, worksheets, and audio tapes, which are available to the public through the internet as well. So the ideal demographic for those practicing ACT would be ages 16 and up, as it does require more mature cognitive processes such as self-reflection, reflection of core values, recognition of destructive thoughts and behaviors, and more, which may be more difficult for a younger demographic. Individuals with healthy cognitive functioning will also be more successful in this therapy for this reason. Lastly, this therapy would be best suited for those with a diagnosis such as depression or anxiety, which are characterized by feelings of distress, but would not be suitable for those diagnosed with a disorder such as schizophrenia and other disorders characterized by paranoia or severe cognitive disorders, as pure acceptance and commitments of thoughts associated with these disorders could in fact be dangerous.
For final thoughts, we agree that ACT is a great choice for specific clients. Its strengths include that it's individualized for specific clients, it's easy to implement, it helps clients in distress to let go of their experiences, thoughts, and memories that cause the distress, and it incorporates a lot of self-reflection, which can foster a lot of personal growth.
So to conclude our presentation, we decided to leave you all with a quote as food for thought. It is only through mindful action that we can create a meaningful life. These are our references. And thank you all for listening to our presentation, and we hope you enjoyed it.